In the previous video, we talked about collimator and crystal in Spect. Today, let's dive into spatial resolution, which is a key component shared by both Spect and PET. The goal of Spect is to capture images that reveal tiny abnormalities and provide detailed information. Spatial resolution measures the smallest distinguishable detail in the image, making it a critical parameter for assessing the quality of Spect. Spect is a complex imaging system that comprises collimators, crystals, electronic architecture, and data reconstruction, all working together in the image chain. Due to its intricate nature, Spect exhibits a nuanced spatial resolution. When a collimator is not used, the resolution of crystal alone is called intrinsic spatial resolution, and the resolution of the collimator alone is called geometric spatial resolution. In contrast, a collimator is necessary for clinical imaging so that the system's spatial resolution can reflect the combined performance of the crystal and collimator. The equation is as follows. R equals the square root of Ri squared plus Rc squared. Does the system's spatial resolution alone accurately reflect its clinical performance? Well, not quite. The reason is that the ultimate clinical images are generated using reconstruction algorithms, and it's the spatial resolution of the reconstruction that truly reflects the clinical performance of Spect. The lens in a camera is like the collimator in Spect, while the sensor is comparable to the crystal. Together, they determine the camera's photographic performance. However, the overall image quality is also influenced by the image processing method employed by the camera's internal chip. Different shooting scenarios such as bright light, low light, shaky conditions, or nighttime scenes require specific image processing techniques to achieve the best final results. Hence, even with similar camera performance, the image processing method becomes the crucial factor in determining the ultimate photo quality. Spect employs a gamma camera equipped with one or multiple probes that rotate 360 degrees around a specific organ in the patient's body. It captures frames at various angles during the rotation and subsequently overlays and reconstructs these images as cross-sectional, coronal, sagittal, or other desired tomographic sections of the organ in different orientations. This process significantly enhances the sensitivity and accuracy of the diagnosis. Spect allows both planar and dynamic function visualization of organs. Spect enables physicians to assess the functionality of vital organs like the heart, kidneys, lungs, liver, gallbladder, and thyroid gland. It provides insight into the blood perfusion of organs such as the heart muscle, brain, and lungs. Moreover, Spect aids in evaluating and identifying any abnormalities in organ and tissue functions, blood flow, and metabolism, including conditions like tumors, lymphatic metastasis, and bone metastasis. Spect whole body bone imaging is a common nuclear medicine examination. It uses radiopharmaceuticals to visualize bone structure, blood supply, and metabolism. It is valuable for diagnosing skeletal diseases, detecting bone metastasis, and identifying subtle fractures. It is also used to assess transplant viability and monitor joint replacement effectiveness. Spect imaging has several key advantages. It provides high sensitivity in detecting bone diseases, allowing for earlier detection of lesions compared to X-ray and CT scans. It offers a comprehensive view of the entire skeletal system, extending beyond the range of X-ray and CT scans to identify lesions. And it can promptly detect hidden or subtle fractures that may be missed by initial X-ray and CT scans. These benefits make Spect imaging valuable in diagnosing various bone conditions, including bone metastasis from tumors and monitoring treatment effectiveness. During Spect myocardial imaging, the tracer is administered intravenously, where it circulates in the bloodstream. As blood flows through the body, the tracer is absorbed by the living heart muscle. The resulting images display varying colors indicating the levels of tracer absorption in different areas of the heart. A normal test outcome signifies adequate and unrestricted blood flow to the heart, whereas an abnormal result indicates insufficient blood flow. Following a review of the images by the physician, a consultation will be scheduled to discuss the results and any required treatment. SPECT pulmonary perfusion imaging is a diagnostic technique in which a small amount of radioactive particles is injected into the bloodstream. These particles travel to the pulmonary artery and temporarily accumulate in the pulmonary capillaries. By conducting an external scan, the imaging can accurately assess the patency of the pulmonary artery and its branches. This technique is particularly effective in diagnosing pulmonary embolism, as it provides high sensitivity in detecting blockages and determining their location, extent, and severity within the pulmonary circulation. SPECT thyroid imaging plays a crucial role in various clinical scenarios. It helps determine the functional status of the thyroid nodules, identifying potential cases of thyroid cancer. Additionally, it aids in diagnosing ectopic thyroid when it appears outside the usual location and assists in detecting metastatic lesions in functional thyroid cancer. Moreover, SPECT imaging is valuable in supporting the diagnosis of hyperthyroidism by evaluating the distribution of imaging agents. Overall, SPECT thyroid imaging provides valuable insights for accurate diagnosis and appropriate treatment decisions. Thank you for watching.